Assalamu alaikum. Today we are discussing right-sided tumor. You see, this is IVC, this is the renal pedicle, this is the edge of the liver, this is the tumor on the right side, this is the lower pole. So we proceed with the, here you can see the energy source should not be used in close contact with the gut. It should be away from the gut or any viscous. You can see here that we have to pull the tissue, pull the peritoneum, and then use the energy source away from the duodenum as well as the colon towards the lower pole, so that the thermal injury can be avoided, because the thermal injury can go here and there for about 2 millimeter to 2 centimeter. So now we come directly to the pedicle. Here you can see we have mobilized the colon, the lower pole, the ureter has been identified, and we have dissected a little bit of upper pole as well. So the renal vein is now exposed. Here the purpose of this video is that we have a problem with the renal artery. It is somewhat behind the renal vein, so we are not able to approach it from below or above. So the trick here is that we know that the artery is more towards the upper edge of the renal vein. So we can pull the tissue behind the renal vein, and then we mobilize. Here you can see the branch of the renal artery. So we pull the tissue and we dissect it and we disconnect it from the surroundings. This will lead to mobilization of the renal artery more towards the upper edge of the renal vein, so that that can be seen easily. Here you saw that the renal artery could be visualized. It was a white colored structure. So here we go bit by bit in order to avoid any injury to the wall of the artery, or for that matter any small branch of the renal artery. So we go there bit by bit. We grab the tissue and we pull it towards ourselves. We stretch it and then we dissect it in small chunk, and then we coagulate it, and then we divide it after coagulation. So this will lead to mobilization of the artery from behind the vein. So we progress slowly and gradually. The main thing in managing, so that has been done now, and now we are coming to the superior aspect of the renal vein. There you can see the edge of the adrenal gland as well. So the artery can be seen behind the renal vein. Now it is free from the lower side, so it can be pulled towards the upper edge of the renal vein. Slowly and gradually we are progressing. We are mobilizing the tissue around the artery. Here you can see we are mobilizing the adrenal gland from the surrounding tissue, so that artery can be moved up and down. This is the adrenal gland, this one. So here one can very clearly see now the pulsations of the renal artery. So the trick in managing the renal pedicle is dissect the artery enough so that one single clip can be applied safely on the artery, and then you can clip and ligate and divide the renal vein, and then later on you can deal with the artery. Here, as the artery has been mobilized from the inferior aspect of the renal vein, so it can be pulled superiorly now. Here you can see that the artery is beautifully dissected. The posterior aspect of the artery needs to be dissected as well, and the tissue around the artery has to be dissected as well. This is just to make sure that the first clip that we are applying is applied completely around the artery. So this has been done now. Now we dissect the renal vein, because we cannot deal with the artery completely. So we have to deal with the renal vein in the second phase of dealing with the renal pedicle. Here we realized that the vein may be distending a little bit, so we decided that we have to apply another stronger clip, because we applied a smaller sized, a green sized Hem-o-lok clip on the artery. That's why we thought that the ligation or the clipping may not be complete. So here you can see a very beautiful large renal artery coming behind the inferior vena cava. So that has been dissected, and now we can apply a purple colored stronger Hem-o-lok clip. And after that we can apply a venous clip. It is really very important to see the hook, the posterior hook of the Hem-o-lok clip before applying it, because if that hook is not visible, it may clip into the wall of the renal vein, leading to injuries. So after that we are cutting the renal vein in small bits and pieces, not just cutting it in one go. The reason is that if there is any small branch or if there is any bleed, the vein may retract, and thus we will not be able to control that bleed. So now you can see that after dealing with the renal vein, the artery is more visible, so you can dissect it proximally, distally, in order to apply some more clips. And after applying those clips, the artery can be divided as well. Thank you very much for watching.